Good evening. My name is Abdulaziz Samhan. I'm a R2 Pediatric Dentistry Master Resident. I'll be presenting my multidisciplinary seminar presentation titled Dangers of Child Abuse from Infancy to Adulthood, supervised by Dr. Al-Walid Abu Shanan. This is my outline. I will start with some definitions and the prevalence, and I'll be finishing with the take-home message. For the key articles, I went with the most recent, and I included some articles that was done in Saudi Arabia. I chose this topic for my multidisciplinary seminar presentation because I think that the topic is still underestimated by dentists, and the literature is still lacking when it comes to its effect on the oral health in adolescents. I also believe that we always concentrate on the oral findings and we miss the small but important signs that are in front of us that could save our patients' lives. Now I'll start with some definitions. The World Health Organization have defined child abuse and neglect as that it constitutes all forms of physical and or emotional ill treatment, sexual abuse, neglect or negligent treatment, or commercial or other exploitation, resulting in actual or potential harm to the child's health, survival, development, or dignity in the context of a relationship of responsibility, trust, or power. The Centers for Disease Control and Prevention defined child maltreatment as any act or series of acts by a parent or other caregiver that results in harm, potential for harm, or threat of harm to a child. These acts or series of acts can be caused by commission or omission. For the prevalence of child abuse and neglect, the World Health Organization have stated in 2020 that 3 out of 4 children who are aged between 2 to 4 years old suffer from physical or psychological violence. Also, the CDC have stated in 2021 that 1,840 death cases of children were from child abuse and neglect in the US in 2019. There are many different aspects of child abuse that can be seen. However, I included in my presentation the most common aspects of child abuse. I'll start with physical abuse. It can come in the form of contusions, burns, or lacerations of the tongue, soft tissue, or frenum. It can also come in the form of fractured, displaced, or avulsed teeth, or it can come also in the form of facial bone and jaw fractures. Also multiple injuries in different stages of healing, or a discrepancy in the history should arouse suspicion for abuse. After that is sexual abuse and unexplained injury or petachy of the palate, particularly at the junction of the hard and soft palate, may result from forced oral sex. After that is the bite marks, and it should be suspected when ecchymosis, abrasions, or lacerations are found in an elliptical, horseshoe-shaped, or ovoid pattern. Next is bullying, and children with orofacial or dental abnormalities, including malocclusion, are frequently subjected to bullying, which may result in serious psychological consequences, including depression and suicidal attempts. I also believe that bullying is the most common type of abuse that can be seen in our community here in Saudi Arabia. After that is child neglect. Physical abuse tends to be episodic. However, neglect tends to be chronic and more insidious, and may present through failure to take the child for appropriate dental care. Next is emotional abuse, and it is defined as a repeated pattern of adult to child behavior that makes the child feel worthless, flawed, unloved, unwanted, endangered, or unvalued. Next, I will discuss some cases of child abuse in the literature, and I need to notify you that I will talk about the signs that will alert us about abuse, and we will not be mentioning any treatment modalities. The first case is an 11 months old female patient. She was presented to the ER with her mother with hematemesis, which is the vomiting of blood. The examination showed bilateral 2 centimeter supratonsillar lacerations and scattered petechiae. However, they observed slough tissue, which indicated wound healing. So when they asked the mother about it, at first she was oblivious, but then she remembered that the child was playing with a stick in her mouth 2 days prior. So they contacted social services, and they visited the mother in her home after 2 weeks. And they observed a widespread facial, buttock, and genital bruising in the child. Also, when they took x-rays for her, it showed that she had skull fractures. And the investigations have showed that all this abuse was done by the stepfather. After that, the social services took measures to deal with the matter. Now I will talk about the dentist's obligation toward child abuse. So at first we need to identify the case. We need to find anything that is worth suspicion of child abuse. After that, you need to treat the victim of his dental needs, and you need to treat as much as possible because you do not know if the child will come back for treatment or not. After that, you report to the local authorities. This is a national study that was done in Saudi Arabia. It aimed to analyze the knowledge levels and the educational experiences among dental graduates in Saudi Arabia regarding child abuse and neglect. The study included 23 colleges. They distributed 1,552 paper-based surveys, and 988 dental interns answered the surveys with a response rate of 63.7%. The results have showed that when it comes to the knowledge, more than half showed inadequate knowledge regarding child abuse, and also that 40% were confident in identifying and reporting CAN cases. However, unfortunately, when they were asked on where to report cases of CAN, less than 10% knew where to report cases of child abuse. Another study that was done in Saudi Arabia, it discussed the barriers to reporting cases of child abuse and neglect. And these barriers include fear of unknown consequences to the child, lack of certainty about the diagnosis, lack of knowledge of the referral procedures, and fear of negative effects on the child's family.